So when the liver produce all these cholesterol, cholesterol is actually a good thing. A lot of people think cholesterol is a bad thing. Cholesterol is bad for the body. I am taking cholesterol medication to block the cholesterol in my body because my cholesterol is too high. No, that is actually what you're doing there is the wrong thing. Cholesterol is a good thing. Cholesterol is your friend. Because if it wasn't for cholesterol, you would have died. And I'm going to explain that. All right. Yeah. So when the body produces all these nice cholesterol, it produces the low density lipoprotein, then it produces the high density lipoprotein. Cholesterol is supposed to go through your system and give the organs immediate energy. So that is the energy that the organ needs to feel good. So immediate energy so it could function properly, so it could work as it should, so it could balance the entire system. That is what cholesterol is supposed to do. That's the bad cholesterol, right? After that, now the body is so amazing because God made this body. The body is so amazing. The body will produce some of the good cholesterol. So the good cholesterol now is responsible for picking up the remainders, what the organ did not use and the body did not use, and recycle that back into the liver, right? So that is the purpose of the good cholesterol, to recycle it back into the liver. So what has happened sometimes with some people, they eat too much of the bad cholesterol, which is all the trans fats and all these things they get from all your nice snacks like the potato chips and all these things. When they eat all these things, they have too much of the cholesterol. So your body have to go through a recalculation process where it recalculates how much of the good cholesterol to produce to pick up on the bad cholesterol that is remained in your blood vessels, right? So that is one aspect, the way how cholesterol can actually damage the body. The second aspect of that is inflammatory food. So the question asks, where do we get our inflammatory foods from? Anything that is processed is considered inflammatory foods. Chicken is also inflammatory food. Sugars is also inflammatory food. So what do I mean when I say processed? Processed is processed foods. So anything comes from a can is considered processed food. All right. So all the tunas and sardines and corned beef and corn in a can and all these preservative things that is on shelves and whatnot, mangoes and all these things are considered processed food. So processed food also, we could also do a topic on that in the near future, like the different types of processed food and what processed food do to the body. We could also do a topic on that. But today the topic is on cholesterol. So when you eat this high processed food, you create a higher inflammatory response in your body. So a lot of inflammation now is in your system, and now the body responsibility is to calm down the inflammatory response. So it uses the white blood cells, it uses the lymphatic system, it uses different systems in order to calm down the inflammatory response of the body. When there is inflammation, too much inflammation damages your blood vessels. And I want you to understand that because I don't want you to get lost during the process. Too much inflammation damages your blood vessels. So we're going to go back now to where today we're teaching. So I like to teach. So we're going to understand now the importance of cholesterol, because today is to understand the importance of cholesterol and why we do not stop cholesterol in the body. We balance cholesterol. We don't stop it, right? So we're going back to the way how cholesterol is important. We understand one aspect why cholesterol is important, where it's immediate energy for the body. Now, the second part of it now, inflammation. Inflammation, once it's in circulation, it damages your blood vessel, right? Because your blood vessel is a very tender vessel. So when too much inflammation is in your bloodstream through circulation, it damages your blood vessel, where it creates a hole to the surface of the plasma of the blood, the surface of the blood vessel, and that could cause internal bleeding. So what cholesterol do, when cholesterol is in circulation and it sees that particular hole, it patches that area up like a foam, right? So when it patches that area up like a foam now, when there is blood moving, when there's weakness in the blood vessel, now that area of the blood vessel will be very strong. All right. So so no internal bleeding, no dilation, no hemorrhaging, none of these things will happen because cholesterol now, inflammation damage the blood vessel, and cholesterol now patch that hole up. So no more internal bleeding. But that is because of high inflammation from your diet. So it all comes down now to your diet. Your diet caused that spike in an inflammatory response, whereby it damages your blood vessel. Now your body, your God-given body that have a natural defense will cholesterol, which will come in and foam that area and patch that area for you so you won't die from internal bleeding. When that happens now, let's say you continue with your inflammatory diet. Let's say you do not know that this mechanism is happening in your system, and you continue with your processed food. You continue with your nice chicken that you get in restaurants, don't want to call any name, all right? You continue eating this bad diet. What will happen now is that your body now will continue patching up these areas. So it will continue doing its job because that's the purpose of cholesterol. The body is trying to do one thing, is to survive. So you continue doing that. The blood vessel is something that dilates, so it's very flexible, right? When that happens now, because of all the patching up, your blood vessels becomes hard and stiff. So it's no longer to dilate anymore. It's no longer to flex anymore. So it becomes a stiff vessel. With that now, it carries pressure back to the heart, right? That creates hypertension. And not that alone, because of all the patch that is happening in your blood vessel, think of it as scar tissue. What is happening there now, you have limited space for blood to flow through because it has so much area that have this yellow patch on, which is called arteriosclerosis, right? Okay. Because we talked about that, I think it's last week, so I just wanted to understand when we say the word arteriosclerosis, where it comes from, right? Okay. Yeah. So that is hardening of the blood vessel, right? So that what that mean. Right? So too much of that causes blood vessels to become hard and stiff, and it restricts blood flow from flowing through your system fluently, right? And when you restrict blood flow from flowing through your system fluently, for example, if you have a diameter of, let me say 3 centimeters, and then you keep patching up this area, now you get a diameter of 1 centimeter, right? So with that backlog of blood, we talk about this in our first program where we spoke about the systolic and the diastolic, which is the diastolic is the pressure that remains in the blood vessel. You guys remember that, right?
Yeah.
Very good. So so with that pressure remain in your blood vessel, because of the space that blood have to pass through now, because of the hardening, which is the plaque that is built up in the artery, the pressure now, when you take your pressure, your diastolic reading will go higher, because when the heart squeeze, blood remains in the blood vessel for too long because it's not flowing through your system properly because of your blockage. So you receive hypertension, high blood pressure because of not enough blood flowing through your system as it should. All right. So everybody with me?
Yeah, we were.
Very good. All right. So in the future now, with the continuation of plaque is continuously patching up the damaged area in your blood vessel, you experience the arteriosclerosis, and now you block 3 major blood vessels, which is the coronary artery. Those are the arteries, small little arteries in your heart. It's responsible for feeding your heart with the nutrition that it needs. And when you block these arteries now, you end up with things like chest pain, shortness of breath. When you walk up a flight of steps, you find yourself breathing very heavily. Mm-hmm. You develop headaches, dizziness, palpitation, arrhythmias. You develop all the complications of heart. And also you develop hypertension, which is not a disease, it's a complication of the blood vessel. So now when you develop these particular issues, and it continue to get worse, because remember, you are not aware of the chemistry and the science that is happening in your body. So you continue with your diet, you continue indulging in the good stuff that is given to you, and you continue blocking up the arteries, because the arteries will continue patching up itself from the damages that you are creating in your temple. So that is why you're supposed to know what is happening so you can prevent it from happening. So today, heart is a very long topic. So we're going to do about 2 sessions of this so we can talk about heart disease after that. All right. Excellent. Yeah. So what will happen now is that you have this discomfort around your chest. And when you go to your medical practitioner, or myself, a naturopathic practitioner, you do things like echocardiogram, you do things like CT and MRI, all these different tests, and then the doctor will determine exactly, send it back cardiologist, and the cardiologist will do angiogram, and then he will figure out exactly you have blockage around the coronary artery. right? So they would say that you need a triple bypass surgery because one of them is 88% block, one of them is 98, one of them is 75% blockage, and that could cause heart failure. So now you will find yourself doing emergency surgery and in the medicals at the allopathic side, and on the naturopathic side, which is my side, we use different products and whatnot, depends on how bad it is. We use different products to help you dissolve the plaques in the arteries, which is our flagship product called Heart Care, right? That is responsible for destroying like the plaques and stuff around the arteries. But we reached there yet. So we understand exactly where how the body does work with cholesterol. How do we control our cholesterol? By managing our diets, also by detoxifying our liver, very important, because with the, I don't know if you ever hear the terminology of fatty liver.
Fatty liver, yes, I have.
Right. So that is happen when the bile duct system is also choked and it's not producing the cholesterol that it should fluently. So what has happened now, the cholesterol now stays within the liver, and now the liver is like one big cholesterol organ. It's fatty tissues all around it. All right. So that's when the liver is not detoxifying itself properly. So that is why it's not that is why we don't say take this product for that. We do a proper evaluation of a patient so we can know exactly there are two different ways that cholesterol could overtake the body. It could be on the liver side, it could be on the diet side, it could be on the inflammatory side. So there's three different ways. So we do a proper assessment of the patient so we can know exactly which side it's coming from, so we can give you the right product to fix that issue. A lot of people, they talk about this product is for you. No, I am a naturopath. I was trained to assess a patient properly and give them the proper recommendation. I'm not a salesman. I am not a herbalist. No, I'm a naturopath. Naturopath are trained to assess a patient properly. I'm not an allopath as well too, where you just come to my office, you tell me your symptoms, and I just write a prescription for you. No, my job is to assess your body, see what is wrong, see where it's coming from. That is why I need the knowledge that I have, because I need to know everything about the body anatomy. I need to know the exact way how the body works in order for me to rectify your problem. That is my job as a naturopath. So everybody have their strength, everybody have their weaknesses and whatnot. So we all have a place in this whole health arena, right? So I always tell persons that if your body is experiencing an emergency protocol, you need to go and see an allopath, which is a medical practitioner. So everybody have the strengths and weaknesses. So I always urge patients to get a proper assessment so we can know what is wrong, not just go to someone and say, I am having a high cholesterol issue, and they write a prescription and that's it, problem solved. No, all you will be getting is beta blockers, which will be blocking it, and you are treating the symptoms, you are not treating the cause. What I do, I treat the cause by doing a proper assessment on the patient, see what is happening with that patient, and give my proper recommendation. Even if it's not in my jurisdiction, we naturopaths give proper recommendation. If you have to go see a chiropractor, if you have to go and see an acupuncturist, if you have to go and see a medical doctor, if you have to go and get your labs work done, we give proper assessment on the patient. That is what we were trained for, right? Yeah. So that is how we assess. We see exactly where the issue comes from when it comes to the cholesterol aspect of it. Do not say cholesterol is a bad thing when you see a report. Cholesterol is not a bad thing. Get that out of your head. We understand that today. Cholesterol is a good thing. What you do to your body makes cholesterol becomes a bad thing. That is how cholesterol works, all right? But without it, you'll be in some serious complication. You actually can end up, if you continue blocking cholesterol by using certain medication, you can actually end up with liver issues, all right? Oh, wow. So that is why, and also the side effects, if you just research it, you will see some of the side effects is also kidney issues, because now the energy that the cholesterol give to the kidneys to function and filter is no longer there. The energy, so end up, but that's why the side effects are listed. So when we understand side effects, we need to understand why do I get a side, why this medication give me a side effect. The reason why I give you a side effect, because it blocks an important part of your body that another part of your body need. All right. Okay.
But we got a call on the line. So we're opening up the phone lines we're talking to Dr. Lewis from Louie Herbal Health Limited, and we've got a call on the line. Good morning, caller.
Good morning again to you, Karachi.
Good morning, darling. How are you?
I'm well, mighty fine. Praise be to God and bless His holy
Mighty
name.
fine at
And
97.
good morning to your guest.
Good morning, Mr.
Good morning, good morning, good morning.
How does one differentiate good cholesterol from bad cholesterol? Thank you.
Okay. All right. So there's where you do your blood works. You do when you do your lab works, they will tell you exactly what is the good cholesterol and what is the bad cholesterol. So you have the again, we talk about that. We have the LDL, which is the bad cholesterol. If that is high, that means the cholesterol levels are too high. Then you have the HDL that normally don't be on the high level. That's being like on a moderate level. And then they will give you, they will calculate LDL, HDL, and VLDL, and they will give you a total cholesterol. So if your total cholesterol pass, I think is about 300 and something, that means it's high. Yeah, right. So they will give you a proper assessment with that, and actually could go to, I think pharmacies do it as well too, where they could walk in and say, I just want to test my cholesterol, and they'll give you a proper reading. They have mobile tools for that as well. I used to do it here. I had a machine for it here, but I more send persons to the lab to get the cholesterol testing done because everybody do it. So it's a very easy test to get anyway.
All right. Somebody says smartphones. What does that mean, sir? Anyway, 328-4176. That number again to call. It's 328-4176. Let me call it again. 328-4176. That's a WhatsApp. You could call the WhatsApp. You could call that number directly. And the office number for Louie Herbal Health is 233-2810. That number again is 233-2810. I hope you have your pen and your paper and you're writing it down, or you could put it in your phone, or you could call it out on your phone and let your phone, if you're driving in your car and you're hearing the program and you're saying, Dr. Louie, I need to come and see you. I need to do my cupping. I need to do my full body assessment. Those are the numbers to call. 328-4176. That number again is 328-4176. I suggest you guys call after 9 o'clock. I know the phone lines are going to be blazing. 233-2810. What somebody's asking? All right, somebody asked the number. Another person is asking. He should say, can pack a bottle or a box. Example, anything packed is processed. I have no clue what that means. All righty. So
no, I think what she asking if things in pack is processed too. And the question is yes. Once it's sealed, refrigerated and have a very long expiry date, most likely it's fall under process. So we'll do a topic on process for our next program. So we could understand that. But health is a journey. And once I start doing a program, is a journey. So you need to understand the first, second, and third program to understand this program. As you miss your class. Yeah, right?
Yeah.
Yeah. So we will understand exactly how processed food creates an inflammatory response in the body, how it derived from the process that it went through, like these things, so we can understand better,
Your phones are ringing already, I see.
Yeah.
Phones,
right. So that is the office number. That's right where I'm located. That is 233-2810. So the next number is the WhatsApp number. So that's to send messages and whatnot. For people who don't want to call and want us to call them, but the office number is 233-2810. Right.
So all you need to do is leave a message on the WhatsApp at 328-4176, and they will return your call. Just say, Dr. Louie, I want to talk to you, and the office workers will call you back. They're very nice, great service at Louie Herbal Health, and of course they got everything for you. I am still yet to come. I do not know when. I have to come and do my cupping.
One of your main listeners came. And she said because you was coming, she came to the clinic and she was happy.
I know that happens.
I think she's listening all the time. I don't know if she's listening or she's listening. She could call. She actually came in because she had a little bit of stiffness in her joint. We fixed her up the same time, right? And she was like, "Wow!" I said, "You need to go on the program and tell Carla what I did today." Please. So I don't know if she's listening. She's listening. She needs to give me a call.
Yes, please.
On this program.
Call us up now.
I can't remember her name.
Call us up now at 625-2759. Those of you that have been to the clinic, she did the cupping.
No. I did a different therapy on her. As yes, call it really infrared therapy. And
Oh, yeah,
she's
fine,
supposed to come back to do the cupping. Adam wasn't here at the moment, and she was experiencing a lot of discomfort. So we had to give her some therapy there one time, and she was very good. So I said, don't forget to call Carla.
Yeah,
said,
so please call me. If you forget to call me now, you can call me later on the program.
So,
I'm on from 1 to 4, so I'll be back with you guys from 1 to 4. But the numbers again to call, guys, are 328-4176. That number again is 328. That's the WhatsApp number. You can WhatsApp that your message and have the office call you back. The office number, however, is 233-2810. That number again is 233-2810. Let me give it to you again. 233-2810. Well, that's it for our program today.
all right.
If there are any questions, let me see. All right. Yes, my dear. You got the number correctly. 233-2810. That's the number to call.
So Carla, we this, as I said before we get into the process and stuff, this part of the teaching will have to continue on our next program because we need to
definitely
understand heart disease and stuff, you know. So it's a nice little topic, it's a nice little journey. Remember, health is a journey, not a one-off. If you one-off is a different jurisdiction. Health is a journey. So right now, what we're going to start to do in our clinic, we're going to start to reward persons for completing their journey, because we know the journey is not easy and nothing good comes easy. So what we're going to do, we're going to start to get people different levels in our clinic, and that level will determine exactly that you are finally completely healthy. You are in your element, and you deserve this pin. So for example, let me give a quick example of that. There was one of my clients, they recommend a next client to me because they saw that client and she was nice and slim and looking good and whatnot. And what I tell that patient, I said, she did not get to that luxury part of her life that easy. She was with me for a year, dealt with all her health concerns, and her last request before she left my office was for weight loss. And I put on a weight loss program, and she's looking good now. And the girl now that she recommended came to start with that level 5 health journey, which is the weight loss aspect of it. She wanted the weight loss. I said, no, you have to do a proper assessment first. We have to see your health. You have a lot of health issues to deal with. When we finish with those health issues, you can experience the luxury part of health, which is weight loss. You cannot get to that part, that level 5 so easy.
Correct.
That patient work very hard, deal with all the health concern to get to that level. So to get to that level, we need to fix these problems. So what I'm going to do, I'm going to start to give people different levels so they can understand that that patient went through her journey to reach to that luxury part where she could focus on weight loss and look 15 years younger.
And I already have the face. I just have to feel. I already have the face. Yesterday, I was talking to one of my colleagues on another radio station on Freedom, and she's like, "What are you doing? What are you doing? Are you serious? That is your age." And she said, "I look like I'm in my 30s." So I don't have to feel like I'm in my 30s.
Yes.
I'll even go so far as saying 20s.
Yeah, so health is a journey. So you just have to feel like it. And trust me, once you reach to that journey, once you reach to that level 5, that level 5 of your health, trust me, you don't ever want to go back there. You will stay there, and you will continue to stay there. Again, see, today was a nice program. Just follow the journey with me, guys. And trust me, you will be very, very, very healthy and rewarding.